Thank you for joining us at Pharmacology Discovery Services, a partner lab of Eurofins Discovery. I am Linda Headley, the Technical Director for the CNS Pain Therapy area. This is the first of a series of short talks on rodent models of neuropathic pain. Today, I will feature models of neuropathic pain induced by nerve injury in rodents. At Pharmacology Discovery Services, we have over 275 in vivo efficacy models covering several therapy areas. These are non-GLP studies in rodents. We have individual technical directors with industry experience for each therapy area. The technical directors work with clients closely to assist them on their study designs and the protocol details. Our facility is in Taipei, Taiwan, and established over 45 years ago as PAN Labs. We are Alac accredited and compliant with several organizations worldwide, such as the Office of Laboratory Welfare. When pain is experienced, it can be acute, persistent, or in some cases chronic. In acute nociceptive pain, a noxious stimulus, such as a mechanical punctate injury or a noxious heat stimulus, produces a brief spinal reflex response to avoid the pain. Inflammatory pain is persistent. For example, when a hammer hits your thumb, you initially feel a sharp first pain, followed by a prolonged aching pain and sometimes prolonged burning pain. Neuropathic pain results from direct injury to nerves in the peripheral nervous system or in the spinal cord. It is often accompanied by burning or electrical tingling sensations. Due to repeated atopic firing of primary afferent neurons at the site of injury, central sensitization, or a wind-up phenomena, occurs in the spinal cord. This results in a chronic pain state, producing an increased sensitivity to a normally non-noxious stimulus, such as the touch of this feather or the brushing of clothes on the skin. Further, hyperalgesia develops, where a normally noxious stimulus, such as heat, becomes even more noxious and produces an increased sensitivity in this chronic pain state. This slide shows on the left several clinical conditions of acute nociceptive pain. On the right, neuropathic pain in the clinical setting can be induced in several ways. For example, distal polyneuropathy, an increased sensitivity to stimuli, is a side effect of chemotherapy, following paclitaxel administration in cancer patients, for example. In another example, following a shingles outbreak from herpes zoster, post-herpetic neuralgia develops, causing an increased sensitivity or allodynia on the skin. Our studies are appropriately designed using randomized cohorts of animals. The technician is blind to the treatment group. The models are validated with standard of care reference standards, and we include a positive control in the study design. The standard protocols can be customized, and we can offer multiple measured endpoints or repeated measures over an extended time course in some models. We offer many options for in-life or terminal sampling, for exposure analysis, or for the detection of biomarkers. On the bottom of the slide, we show how we measure neuropathic pain in rodents. On the left is the Hargraves method. Here, a noxious focused light beam is presented to the plantar surface of the rat's paw on the same side as the nerve injury. The paw withdrawal response is measured in seconds. On the right, the mechanical allodynia measurement employs von Frey filaments of varying force and the Chaplin up-down method. The individual filaments are applied on the plantar surface of the affected paw to determine the paw withdrawal threshold. The CCI model was developed by Dr. Gary Bennett several years ago. Here, nerve constriction is induced by tying 4 chromic gut ligatures loosely but close together around one sciatic nerve of the rat. The spinal nerve ligation model developed by Drs. Kim and Chung produced neuropathic pain following a tight ligation of both the L5 and the L6 spinal nerves just distal to the dorsal root ganglia. A sample study timeline for the SNL model is shown here. Pre-surgery baselines are taken. About 2 weeks after surgery, we verify the development of neuropathic pain and randomize the animals to treatment groups. In this study, we dose therapeutically with the test compound. In other studies, we can dose preemptively for a disease-modifying approach. Upon the client's request, the animals can be retained, washed out, and re-randomized for another experiment. The spinal nerve ligation surgery in rats produces proximal nerve damage and central sensitization. A clinical correlate in humans would be disc prolapse, for example, resulting in nerve injury and chronic pain. The graph on the left shows the mechanical allodynia measurements with normal baseline pre-surgery withdrawal threshold, and then the post-surgical thresholds that are significantly lower. Gabapentin dose-dependently reverses the mechanical allodynia. Gabapentin, or Neurontin clinically, is our positive control when administered at 100 milligram per kilogram orally. On the right, an increased sensitivity to thermal heat produces hyperalgesia following the nerve injury. The hyperalgesia is reversed by morphine at 1 and 3 milligram per kilogram subcutaneously. We also provide the spinal nerve ligation model in the mouse. Here on the right, we ligate only the L5 spinal nerve. A similar timeline is shown for the development of neuropathic pain and the evaluation of test compounds. The bar graph shows a dose-dependent reversal of mechanical allodynia thresholds following gabapentin orally in mice. The chronic constriction injury, or CCI model validation data is shown here. The CCI model produces neural damage in the rat. A clinical correlate would be nerve entrapment, as in carpal tunnel syndrome, for example. Gabapentin at 30 and 100 milligram per kilogram orally reverses the post-CCI induced mechanical allodynia thresholds, as shown in the graph on the left. Similarly, on the right, morphine at 1 and 3 milligram per kilogram subcutaneously reverses the thermal hyperalgesia produced by the chronic constriction nerve injury. This concludes the short summary of 2 established rodent models of neuropathic pain induced by nerve injury. Thank you for your attention, and we look forward to working with you at Pharmacology Discovery Services.